Good morning. My name is Zoila Reyna, founder of Public Health Hired, and I am so excited to welcome you to this week's Job Application Lab. I host a special lab where I provide actual live feedback to your resume based on an actual job that you want, that you're applying to, and I help you really position yourself as best as you can. So this is really active learning. I have usually a couple participants, and I offer this about once a month or once every other month. The way to access it is through the Masterclass, HIRED Masterclass, always enrolling and ready when you are to join us during Tuesday office hours, which is how this job application lab is being offered. So go ahead, sit back and learn about how I help all of you get jobs in public health. Let's get you hired. Job application lab where I essentially offer live resume edits. So if you've been applying to jobs or you want me to look at something you recently applied to, all I ask is that you actually are willing to share your resume. You're welcome to take off any information you don't want folks to see because you are asked to share it in the chat so everyone can open it and have it. So go ahead and you can submit your resume in the chat without your personal information. That's fine. And then you have to be willing to share the job that you are considering to apply to or that you already applied to. So that's basically the rule. You just have to, come ready to share. I am going to prioritize those who are unemployed. So get ready if you are unemployed really at any point in time. So even if you were laid off this last month or in June or in April, or you've been unemployed for a year, I want to give priority to those of you who are unfortunately not who are without a job right now. So I'll give you guys a second to submit your information. Okay, Alicia, are you there? We're gonna start
Yeah.
chatting. Hi,
Hi.
how are
This
you,
job is
Alicia?
kind of it might be a stretch, but it's something I saw and yeah, I would love your feedback.
It's okay. Did you already apply? It's one you want to apply to?
No, I haven't applied yet. It's
No.
something I just saw
Okay.
this week. So,
So folks aren't aware, it's Feeding America. I'm gonna go off my video again and just share my screen. It's Director Health Impact Innovation. Got it. Okay. And I want a nice six figures. I want to make sure that you're going to meet this hefty qualifications down here. Half of this is fluff. It's like deciphering which is fluff, which is not. That I know Sean, if he's on here, is really good at continuing to help me lift that for you guys. Like, what do you mean by that? I would say like this is important. The first two bullets are important. Some of this might be like social media, digital marketing. This doesn't matter. This doesn't matter. Systems thinking, kind of, strategic frameworks. This matters. This last sentence right here matters. Experience translating thinking effectively for donors or customers to successfully generate funding or sales, strongly preferred. Notice the strongly preferred was added to that sentence. Demonstrate a track record. Some of this, not so much. So I'm going to keep that in mind as I review yours real quick. Let's see what you submitted. Um, thought I had it open. There you are. So have you touched it at all? Oh yeah. Alicia, have you edited?
sorry, Zoila. Yes, I started the first couple sentences, but I need to work on the summary again still. So for this.
All right, let's do.
Um, so yeah, I'm still on progress.
I'm gonna just do that. Slice it. The top is the job, the bottom is you. 8 years, progressive experience across nonprofits, hospitals, and FQHCs. So no private sector in your resume?
I do not have private sector technically experience.
The nonprofits. What's this one?
That is like a medical patient representative I was in a medical office, for a
Oh,
doctor.
healthcare. Healthcare.
Yeah. So
Okay. You can
technically,
cite healthcare. Um, School? You worked on schools, but you were hired by the nonprofit for the Bay Area. Do you have any experience with the food as medicine or food?
so I do know of programs that I worked with that. So I worked with as a program manager. I did work with Advocate Oral Health, and they had a CDC sponsored diabetes prevention program. It wasn't technically food as medicine program, but it worked a lot around um, kind of food as medicine models.
Yeah, like
So
food. I've heard
yeah,
it like food for prescription medicine.
prescription. Yeah,
Yeah.
they had a food pharmacy they would
Oh my
follow.
God, girl. Alicia, you're killing me. Yes.
I didn't really technically put that in my resume, but I probably should for this. Um,
Yes.
I guess I was just mainly wondering what to highlight for these
Well,
types of
that
roles. I
needs
know
to go
these are
up
kind
there. I
of,
mean,
but
they want specific experience in the food for medicine programming or health policy space. So if you're not
yeah,
citing that first and foremost, that you have something,
yeah, I have a bit of that, I guess I would
that's
say.
all they need. That's all they need.
Okay, so include that.
Include that. Um, I like that you mentioned program innovation. That's good. And or product solution development, including ability to shape expansive thinking. I'm going to minimize this. Like,
Yeah, I do need to tweak that summary a bit more, I think, too.
well,
Like,
that's gonna make the biggest difference. Strong track record, imagining high impact standardized
I
prevention.
guess I struggle with like too much versus too little, which I guess is everyone's probably thing with the
Yeah,
summary.
it's
Yeah.
okay. And there,
Yeah.
I just hid the ones that are examples. Where did it go? These are the examples that you can kind of,
Yeah, I was looking at
right?
some of that.
So I know it's tough it only needs to be 5 to 8 lines, as long as you're meeting the 5 to 8 lines, 5 to 8 lines. Now, I try to remind you guys that the formula to this is the 8 areas. If it doesn't fall into this, it's fluff. If you can't fit it, right? So when you're reading, where'd you go? When you're reading this, things should fall into those categories,
Okay, okay, yeah.
right? So that's why I'm like, okay, well, some of it is just fluff because it doesn't, where are you going to fit it? Like and mind you, I am telling you guys, okay, well, you need to make, like this experience with food as medicine program. Maybe you took that literally. You're like,
Hmm.
well, I don't have experience with your food for medicine program. Is that what
I
you thought?
have, yeah, I have worked with their partner, which is the Greater Chicago Food Depository a lot. I've done projects with them, so I
And is that
probably,
cited in your resume that you have
no,
partnered
I don't have it.
as
Yes, I should
that would
probably
be
put,
part of it? Yes. Yes.
yeah, because they work with them a lot.
Yes.
But that's
So
also their
here I
lead.
do see you were trying to mention something about adults, diabetes, great, but
Yeah, I was trying to mention something like that. I've
Mhm.
worked with that actually.
But I think if you want to say like food pharmacy or food as medicine models
Yeah, maybe I should,
is
yeah.
enough, is enough. Yeah. Yeah.
Okay,
Yeah.
thank
And
you.
at the top, the higher, right? To them, it's the first thing. So for you, it needs to not be buried either. Just more of that. Now things around this that you added, skills and conflict resolution, trauma. Is this just
Yeah, I was probably going to remove that for this role.
carryover? Yeah.
Yeah, it said some things around management of teams and things like that. But yeah, I can fit that into like a bullet or
Oh,
something.
because you'll be managing to volunteers.
Yeah, it said something about, yeah, volunteers or teams. Uh, and then it had some leadership qualities at the end of the job, which was new, or competencies, which I haven't really seen before. Yeah, those
It?
leadership. Yeah, I'm like, is that
That's fluff.
that's fluff? Okay. I'm like, I usually don't see
I
that.
mean, I see the required part of it, which is confusing, but the best you could do is maybe lift like, oh, you collaborate. Like
Right.
not that off, far off, but like the way fosters an enterprise mindset, fosters and to me that's like here you could say
I've managed teams and I've managed several
right,
people. So
right. So you could say like strong track record in managing, and I see you talk about training staff. So this needs to be kind of modified, this that it needs to more just use their language around like fostering
yeah.
supportive learning environment for teams and staff, like something
Okay.
to that effect if you want to borrow from there. But even if you don't, you would be fine because you have plenty up here where they talk about diverse internal stakeholders and lead through influence and collaboration, and you would already naturally have hit on that.
Yeah, I have
If
done
you
that.
do
So,
this correctly, you would hit on this.
oh, right.
So I'm
Okay.
showing you that some of it is more fluff because, well, it's already here. It's not like you need to do extra. So yeah, I think it's halfway there, Alicia.
Okay.
I think this is
Yeah.
halfway there. What other questions do you have now? I always tell you guys the bullets only need about 60%-ish. You don't need to worry about like these bullets, their bullets, you need to borrow about half and
Okay. Yeah, that
use
I need to
their
work on
language. Yeah,
a
use their
little bit
language.
more.
And if you get stuck, you could use their verbs as much as you can, like provide, oversee, partner. I try to say this as much as I can. The reason this matters is because the verbs, the actions, the way that they want this person to show up in their job is directly associated to the strength of responsibility of that title,
Yeah.
right? So they need to see that you have been practicing those actions of overseeing and partnering,
Right. Right.
serving as a
Okay.
subject matter. So you're alluding to that, which is why you only need to do about 50%, get some of those verbs.
Hmm.
And then, it's not going to be exact. Like some of this, you're like, well, I don't know if I've done that. It's like, okay, pass, pass, pass. But some of this, you've done, Alicia.
Yeah,
Like,
that's why I was like, I think it's a little bit of a stretch, but then it's also like I've kind of done some of these things too. So I thought I could possibly qualify.
yeah, if you can
If
nail
I did
this
it
down,
right.
nail as much as you can here, and then relax more here in the bullets. So I tell my mentees, you want to put as much energy in the summary. Once you nail that, the rest is just pick and plug and play almost like, okay, I'll take this, I'll borrow this. And then what other question do you have about this application?
Um, I guess for my bullet points, I'm not sure if I'm going too much into detail or like
Seven.
too
I don't like
long.
this. Why did you leave it like that?
Yeah, that I need to work on for sure before I submit that. I was kind of listing these out, but I should make this smaller. Are you?
Yeah. So great. You only need 7 roles.
Okay, seven.
You only need 7 on a 2-page resume. So you already have 1, 2, 3, 4, 5, 6, 7 without the leadership.
Oh, so don't even include it then, or
You don't have to, but what you can do is like are some of these are not roles. Some of these are just certifications. This can go, ooh, this should some of this can go in your summary.
yeah. So some of this, I mean, I'm like part of some affiliations, things volunteer. So I thought that would be important to show, like I have
Mhm.
community engagement, leadership, things like
The
that. But
things that matter is that like speaker, this one.
yeah, I've been a speaker a few times.
But if you volunteered anywhere like this one, the Chicago Hopes for Kids volunteered 2018. Also, pick the one that you worked closest to food or donations or canned food drives.
Yeah, okay, I
Right?
have that.
Think
Yeah.
food, like anything where you've pulled food together for
Yes, I have done
community.
that. Okay, portfolio.
That's
Yeah.
the role you would choose or swap out. Because
Okay,
again,
that's
you don't
good.
have to list everything. You just swap out or play with the timeline. So your master probably has like maybe 10 roles, for example,
Hmm.
and then every time you apply, you get to pick from those seven, just making sure there's no glaring. The other thing is you need months.
Oh, months. Okay.
So
Because some,
month, like here, did you just do 1 month like of work?
no, I've worked there for about a little less than a year.
Okay,
So,
so do the months like
okay.
January to November 2024,
Okay.
whatever that looks like.
Because I moved to
That's
California after that. So,
yeah, it's okay. And then here too,
okay.
your
Okay,
your
months.
school, you need to put month, yeah. When you graduated, just the month and the year. And then for those of you who are expecting to graduate, you can always put like expecting December 2025, for example. That would be suitable. Like if some of you, for those of you who are in school finishing up, that would be fine. Okay. Do you feel better,
Okay.
Alicia?
Yeah, thank you. Yeah, I
You're
appreciate
welcome.
you
Yes, yes. And
going through
obviously you
that.
still got your cover letter, girls. Okay, Alicia and then Angelica, right? So we have Angelica. Okay, so I see the resume and then where's the job?
Should be right under
I don't see it in the chat. Try to minimize. There we go. So there's your summary. So I'm gonna first make this big. Ah, gonna zoom in a bit. Here we go. So this is the job. I immediately look for qualifications, guys. That's my cool remote. Good find. Now this is a good example. Ooh, good example of the fluff mixed in with what matters.
yeah.
Ah!
I was like, which one do I pick? I'm like, I think it's longer, my summary.
You're like, what the hell?
Yeah, I was trying to pick the most important ones.
You're like, what the hell? Okay. Okay, so from your assessment, have you touched anything on your like have you attempted this, I guess?
I did. I tried to, but I feel like my summary just started getting longer, and I'm like, where am I putting in fluff there? Like you said, it's hard to take out the fluff from also your own summary. So I tried my best. Hopefully, I
Okay.
didn't add anything. I just need an extra set of eyes.
No, 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 I hear you. Okay, so this is a good example of why keeping the formula in mind will help you like weed out what matters and what doesn't matter, so to speak, right? So, now mind you, some of the skill sets still sound a little elusive, but I try to stay as close to the experience, what is it? The required, preferred, desired, anywhere near that. So like for example, they even cite the years, minimum 3 years customer service experience. Um, Wherever they say years matters to them. So this is another thing that matters to them. 2 years in technical support experience in a call center or proven technical ability, which you have. The other one that matters, collaborate with colleagues and staff. Here's the software, Salesforce, Microsoft. And then past experience with communications company in a customer service environment. So customer service keeps coming up. So customer service, communications company. I don't know why communications company, but I think they're trying to hit on like the call center environment or just the telephonic virtual world space where they want you to be comfortable in. Because what company is this? Isn't this healthcare?
It's um care caption. Clear it's care captions.
Oh,
Yeah, it's clear captions, so I'm sorry.
there it is.
Yeah,
Clear.
so I think yeah.
Oh, clear captions. Yes.
Yeah.
Oh,
Yeah.
oh, wonderful. Okay, that makes sense. I mean, they're technology communication
Yeah.
based. So then. customer installation and customer installation support experience. That's the only other one that kind of stands out to me. Troubleshooting. To me, this is like making sure you walk them through and provide technical assistance when someone is having like
Mhm.
access issues, right? So anything like that they want to hear about. So when it comes to your summary, let's look at it now. The qualified candidate will have experience in verbally explaining complex information in concise terms to customers. So that's something we could borrow from, but I'm going to start with this years that they want, which is 3 years customer, 2 years technical support, and then lead into explaining things concisely for
Mhm.
customers. So 3 years experience, oops, in customer and operations with 2 years technical support. You don't need to talk about roles with 2 years in technical support. A good rule of thumb is don't put titles in your summary unless it's referring to others. So like if you're talking about collaborating with nurses, that's fine. But you don't have to identify yourself as such, for example. So 3 years of experience in customer service and operations with 2 years in technical support and technical assistance, because it's different. And technical assistance. Why partnership management?
I put partnership management just because I work with different in my past role, I would work alongside other like management teams and like if there was a problem in store, I would call in technical assistance and then I would be the one to help figure out what was the problem.
Technical assistance, working collaboratively with colleagues and staff. I think you're trying to say what they kind of already have here. Do you have any experience call center? No.
No, but I did handle a lot of customer issues over the phone.
Customer support. Telephonic, phone, and via is the 2 years technical support, and is this separate from 3 years that you're citing up here? So
Yeah,
this is referring to the hospitals
the 2 years would be the
with,
hospitals and then
yeah,
part of it would be my operations experience.
yeah, I know, even helping with public health hired. So with 2 years in technical support and technical assistance, working collaboratively with colleagues and staff. I think that still fits it. Yeah. 3 years of experience in customer service, customer support, operations, and communications, including answering phones with 2 years. Because I can't say call center, I'm trying to let them
Yeah.
know that you basically can do it's like you're in it. You've already been in it.
Mhm.
You can
Right.
handle it. Um, I like the I don't want to take this out completely, but you kind of repeat yourself here. So I'm going to just collapse this.
Okay.
So I see you say partnership with hospitals, and then you say known for collaborating and supporting partners, including hospitals. So we could just say, since we already said collaborating, we'll just, you have most of it. It just needs to be collapsed. Taking that out, it doesn't add anything. Solutions oriented and proactive with a track record of identifying challenges, anticipating needs, and improving. I think we already say solution oriented or high risk
Is that where
being.
you're at? There's a bullet that you mentioned the last time was ability to work. Does that sound like, because I tried to like kind of sound it like that, but not really exactly like that. I am not sure if I kind of like executed it properly with that sentence that you have highlighted.
Well, my question to you is why didn't you just use their language,
Oh, okay, got it. Okay.
right?
I was thinking of putting it, I actually had it on there and then I took it out.
Yeah, because if it's true,
Yeah.
it's true, right? Like, well, yeah,
Yeah,
it's true.
right.
I just would
Okay.
not say it that way, which is what you guys have to
Right.
be comfortable with. Um,
Okay.
because keep in mind, this is also protecting you guys against automatic screening, right? Where they're like, oh, we're looking for results driven team. Like if they're using things like results driven or
Mhm.
customer, what is it? Call center, like they're going to sometimes just look for key terms around that. So that's why I want certain things to hit, like the customer service or communications,
Mhm.
technical support. Like if they use those terms to flag you, they hopefully will pull you in. If it is an ATS system, if it's a manual person, you also want to make it easy for them to see it. So
Okay, got it.
you adding another layer of interpretation is kind of what is making everyone go in circles. But I like what you're saying around standard operating procedures, but you kind of already said that, yeah, with with four, or you could say for underserved or known, here we go. Um, background in strong background, proficient in demonstrated background, training, workforce, providing demonstrated background in workforce development initiatives. Eh, sorry, I'm trying to lead into um hold on. we don't need the workforce part. I was just trying to lead into demonstrate a background in I mean, I like it because that is you though, right? Angelica,
Mm,
that I mean, you're
right.
supervisory, so demonstrate a background in workforce, but I don't know if it fits somewhere else. Demonstrate a background in workforce development. DEI?
Yeah.
That's it.
Okay, perfect. Thank you so much.
That's it. That's it. That's it. Now it hits on
Okay.
population, stakeholders,
Mm-hmm.
environments, their language, skill sets, focus areas, software,
Mm-hmm.
you know, and hopefully keeps this other fluff out. This was tough, girl.
Yeah. Yeah, that one I had a difficult, yeah, that's how I was like, how do I like make it flow?
You guys
And
probably
like you
even
said,
felt you guys even felt like, oh shit, she's trumped on this. I'm like, yeah, this is not easy. This,
yeah, like there's a lot of information I could use, but also there's a lot of fluff, like you said. So I was like,
uh-huh.
picking out the fluff was a little bit difficult for me.
Mm, great example. Yeah. So now you can jump into your cover letter as I sh had shown you. So you take the first two
Okay.
lines, which is, like half of your
Yeah.
summary, which is great. But you take the first two
Hmm.
lines, jump over, and then any other questions on that? Or was that really
I think that was the only one that I really needed help. I just need a second pair of eyes just to see if I'm actually doing it correctly.
like, how do I do this? Yes. So
Yeah.
um
Okay.
I
Perfect.
will save, and then if anything,
Okay.
I can at least throw this in the chat. Do you want me to put it in the chat? Just so
Oh
it's
yeah, whichever works for you.
um I know I'll eventually email you, but if you want to just grab it, you have it now.
Okay, perfect.
Okay. So pulling up your information, Odelis, you dropped it in the chat for those of you who want to follow along.
Morning.
Thanks for joining. You are on it, girl. All right. So, did you apply to this one or are you about to apply?
I'm about to apply.
Love it. Okay. We are looking at the County of LA Health Program Analyst. Nice pay, 87 to 117. All right. It is due Wednesday the 20th. Oh no, they do this. They have a window, right?
Yes.
Oh my gosh, LA County is the only one that does this. Ah, would love to hear if you guys are running into this, but LA County is notorious for having like a very specific window of submission. Um, I think one time a mentee told me she had like 5 hours or something like that. So watch out, basically. So that is, I hate that they do that, but it is what it is. Okay. So have you attempted this edit or like, do you know what you're doing or you are starting from scratch?
I feel like I'm starting from scratch. I've attempted to make my resume more like again smooth, and not have it overburdened with something.
Right. Okay. So just before I jump into this, county, even LA or like large counties, state government, local government tends to have like a couple forms to keep in mind, or you might need an exam, or you might need to answer supplemental questions. So while they have their qualifications here as option one and two, they may also have um, like hidden additional questions. So desirable, they say anything beyond minimum. There's an exam. So there is an exam for this or no?
I, I think the exam consists of answering the questions.
Candidates must meet. Okay, so sometimes their exams is associated to the questions. So there is a list, there is a questionnaire. Did you find it?
Yes.
Or, okay. Is that in here? Is it a link in here?
I think
Or is it
it is.
something you can drop in the chat?
So if
The
you go
question,
further up, you can just click on questions on the right.
yes, that's right. Thank you. So this is important because this is actually this actually aligns to their highest qualifications. This is part of you lifting what matters to them in your summary, in your cover letter. So this is why I like to jump to these questions because it does help you, they're going to weed you out basically based on whether or not you can answer this. And if you can't answer this, then you know your answer, whether to apply or not. But if you feel like, yes, I can answer to this, then yes, we move forward. So have you done your sense making on these questions here?
I haven't answered them per se, but I feel like I'm qualified.
Yeah, and they sound redundant. Um, they want you to make sure you understand some of this, but the meat of it is here, which is they want to make sure you understand what they're trying to get to. So this is literally repeating their highest qualifications. You probably saw that where they had option one and option two. So they're simply making sure you hit on this. And then here they talk about submitting your transcripts, I believe.
Mhm.
Perfect. Okay, more information on that. And then they want you to address this one around how many years of experience you possess at the level of management analyst performing assignments in mental health or public health analysis. They do have a definition for you, defined as a study investigation. So how many years do you feel you have this?
I feel like I do have a year, but I don't know if it matters if it's part time.
No. Um, no, here it would say like 1 year experience full-time paid versus like sometimes it says, oh, must be postgraduate experience. Like sometimes they're like, after you got your degree, have you been, working in that field? Um,
Because the way I was what I'm thinking was a Jeopardy for question number or no question number three in terms of the qualifications. I'm like I do have a bachelor's and I have my master's, but I was thinking of using the master's as 1 year of experience.
your master's is now, you just graduated.
Mhm.
Here we go. Master's degree may be substituted for 1 year. Yeah, so it's okay if you have 1 year, 1 year. A bachelor's degree in 2 years or a master's degree. So you have master's plus 1 year.
Yes,
So you qualify.
yes,
Yeah, you're not substituting.
no.
Right. Okay, just want to make sure. Okay, that's fine. And then please describe in detail your experience performing this. So you have to be able to describe is your experience in the mental health or public health or both?
Both.
Okay, where? I have your resume on screen. Can you point out which roles?
So for the Georgia Community Service Board, that was more like a mental health, where we were evaluating the basically mental health clinics in the state of Georgia,
Okay.
where we interviewed and did like assessments of the facilities.
Okay. And then I see you're a graduate research assistant for mental health as well.
Yes.
Love it.
And then before that role, when we scroll down, I did more mental health, but directly providing service for that position for the personal service coordinator job.
So, girl, you have more than 1 year.
I never know how to, I guess, describe it since like my experience before grad school was direct service versus in grad school it was more on working on projects.
Oh no, Dallas, you're underselling yourself if you think of all like your work as like direct service versus public service. So, I would say like,
Because if you scroll down, I also have more like on mental health, like the bilingual outreach, kind of a little bit of both.
oh my God, I hope everyone else is seeing what I'm seeing, which is, oh, Dallas, you have like 4 years, which is great, of experience in mental health and public health. So you qualify for the highest. So I don't want you to select 1 year. I want you to select 4 to 5 years of experience.
Okay.
Now, this is not overshooting because they are actually giving you these options. Like, even if you want to choose the 3 to 4 years, you're
Mhm.
better off than just citing 1 to 2 years because you do have, um, so for example, like this immigrant, wait, conducted trauma-informed care intakes. All right, I see Maxim. This outreach engagement for mental health, public health professionals. So this is more in the public health. Yeah, because you could say both public health and mental health combined,
Okay.
right? So up here you would say over 4 years of experience in mental health and public health, right? And then you could say in like here for this. They care about this. For studying and investigation of issues and problems, development, implementation, administration, or evaluation. So you have to be able to almost like, if you feel like, well, all of my work is really in the implementation administration, some of it may be evaluation, a little bit of development, that's fine. But you need to be able to use this language, is what I'm saying, in your summary. So, like, over 4 years experience in public health and mental health do you have the development piece? Or is it mostly like the research, the
In
implement?
terms of in terms of development, it's usually like the tools that we use to kind of
No,
evaluate or obtain that
development,
information.
yeah, development is like curriculum development. So if you taught, did you help with curriculum development or, yeah.
Yeah.
Oh my God, girl.
Okay. And yeah, other roles maybe that I'm probably missing the curriculum development, but I think I could add that as
I mean, but that's how you could disclose it. Like if they're saying must have X years, you're going to say you have over 4 years in mental health, public health programs for the study and say like prevention. If you're like, well, I don't really investigate, right? Because some of us are more in like the, say, traditional epidemiology kind of data analysis spaces. And my point is use as much as you can. You can say like, well, I study, I evaluate, I investigate, sure. Issues and problems, mental health, public health programs for curriculum development, right? Um, implementation, program administration, and evaluation then you can add environments for context, saying something like within university settings, um, what was it? Nonprofits and government, right? Because housing is a public health issue too.
Hmm.
So all of your work counts for all of this. I think it's you not seeing yourself so literal in like, well, it's a direct service kind of, no, but the issue and the, right, what you helped address is the public health cause issue.
Okay.
Does that make sense?
Hmm.
Okay. I know I didn't type this out. Did you take notes and type it out or anything?
I think I did.
Should I try to type something out in the chat maybe?
Yeah, that would be helpful.
Oops.
Do you think that I should use the master's as a 1 year of experience or just use my experience that I have?
No, you have plenty. You don't, I mean, so in your in your summary, you don't have to cite your master's.
Okay.
But in your cover letter, you will reiterate, given my education, my master's, my qualifications include my master's degree and 4 years experience. You see?
Yes.
So that is what you do say in the cover letter, but not in your summary. Over 4 years experience in mental health and public health programs, including study, evaluation of issues and problems. I don't like how they say that. Evaluation of of issues and I'm just going to say SDOH, including, wait, public health, including study and evaluation of initiatives, of issues and initiatives that address curriculum, including curriculum development, implementation, program administration, and evaluation. I feel like I said evaluation twice. Nah. Initiatives. Over 4 years of experience in mental health and public health programs, including study and evaluation of issues and initiatives, including, oh, here we go, including study and evaluation of issues and initiatives, curriculum development, implementation, and program administration. That's why. For university settings, for universities, nonprofits, community-based organizations, and government agencies. Boom, Dallas.
Thank you so much, Zoya.
That is your first line. The rest is in your hands, sweetie.
Thank
Yeah,
you.
this was a bunch they love to confuse you on this one. Like they say the same thing like 5 times. So it's like it's like they're trying to help you, but they almost make it worse.
Hmm.
You're like, I don't still know how to do this. I call it the summary math, right? I think that's where you were stuck, is like, what's the math
Yeah.
behind this? Um, So yeah, I think Odellis, you have extensive experience. It's more around how you frame it and staying true to yourself. And I don't think anything I put in your first line is false, but if there's something you feel like you need to move or soften or whatever, that's that's up to you. But you can also add a second line to keep qualifying, like if you're saying if you evaluate, then give examples of that in your next line, right? So strong background in project management and evaluation, including gap analysis, risk assessments. You see what I mean? So you can give more
Mhm.
examples from there, but I think you hit on their highest qualifications. So, yay. Yes.
Thank
Now you
you.
can keep going. Yeah, you're welcome. And make sure you meet that deadline in that exact window. Good luck.
Yes.
So I see we're at time. We're a little 5 minutes over. Thank you so much, everyone, for staying a little over. I know, I think Cynthia, you wanted some help. So hopefully next time we have time for everyone else. I will be here next week doing traditional office hours. And then if anyone is in the Central Valley, I'm actually going to be in Fresno next week at the UC Hire event. So if anyone is in Bakersfield, Fresno, Visalia area, would love to connect with you. I'm going to do some social media outreach to see if anyone wants to meet up for coffee. But yeah, I'm going to be at a hiring event. So thought I would try to connect with you all if you're there. But yeah, so besides that, have a wonderful day, everyone, and keep applying. You can do this. All right. Thank you for coming. Thank you for joining me for this hour. Bye, everyone.